have a look at Zach. He's our cat. Would you believe all of his problems over the past couple of years have ranged and included dentistry issues, arthritis, he's missing part of his hip, pancreatitis, chronic renal insufficiency, some mild hypertension, some proteinuria, and a heart murmur. And to top it all off, just recently we took off a tumor from him. It was a basal cell carcinoma. Now with all these health issues, and being 19 years old, is it the inevitable? Is it time to put him to sleep? No way. Look at him. He loves his life, and he doesn't know about any of these problems. He doesn't perceive it at all. As a matter of fact, Zach's like Bruce Willis in Die Hard. He's Mad Max in the Thunderdome of his life. He's like the original trilogy, but not the prequels. He's Uma Thurman, Kill Bill. And even though he scratches our furniture and pukes all over the place, he's a part of our family. So as long as this guy continues to look the way that he does, he's sticking around. We're gonna give him the things that he needs to make him look like this at 19. Zach is doing great, and giving him subcutaneous fluids was part of that. So your vet sent you home with a whole mess of things, including these fluids, and we talked a lot about what could be going on. All these words sounded so alien, and they just didn't sound good, did they? So you're back home and everything just starts to sink in, and he's stressed and your wallet weighs less, and you never imagined having to stick a needle into your cat, did you? You don't want to hurt him, and maybe this is the first time you ever had some type of illness and the first time you've had to contemplate some type of treatment. At the end of the day, you just want him to get better. You don't want to feel like you're letting him down. Now I can tell you this, by giving those fluids, you're now part of a group of people who can see their cats live longer and healthier despite what has happened. In some ways, learning these things is a blessing in disguise. If I've taught you the right things to look for and you're targeting your therapies, like subQ fluids, for those issues, you're going to see good things happen. Ren knew this, except he just injected animals with alcohol and it just made them drunk, whatever. Lada was the first to give a successful injection to people in 1833. So people have been doing this for a long period of time because it works. Now there are plenty of reasons to use fluids, but I feel it's a health optimizer, especially for older cats. 14 is the average age of a cat, but not for me, no thanks. I want a lot longer than that. Okay, let's do this thing. So grab everything that I gave you from the clinic or that your vet gave you from the clinic, and I don't know why they make these so hard to get out of the bag, but they do. So just get your saline, usually it's lactated ringers I'm giving you, and you're gonna pull this out of the next bag. That's your IV line and tubing and all that. And then I give you some needles and stuff. So what you're gonna do is take your line, the pokey part in one end is going into the port on the other bag. And they're all gonna look different. But the one thing that's the same on all these bags is that it is a pain in the ass to get these things off. Like it's so, look at that. Okay, there you go. I didn't drop it. So without touching the pokey part, right there, and without touching the tip of the bag, you're gonna throw these two things in. Just throw it in there. There you go. And I did that without contaminating the tips. That's great. So now they're connected. It's solid. Awesome. That's what it's gotta look like. Don't touch all that stuff. Don't touch the tip of the bag. You're just gonna contaminate it, and then you're not gonna really want to use that. So here's the other tip of that line. You're gonna peel that needle right open. Don't touch the tip. You don't want to contaminate it. And then you're going to throw that right into the other end of the line there. Just like that. Awesome. Yeah, don't do this. Don't touch those things. Okay, so now you're gonna get the fluids running through the line. It's really simple. So basically, all you gotta do is, the whole point is fluids go from A to B, from top to bottom. Squeeze that, fluids are running down. Forget that part. You're not gonna care about that. The fluids are gonna run down. If they're not running down, just keep on working down the line, and then you're gonna see little blue clips. Sometimes you gotta loosen them up. Then you're gonna see this doohickey, and you just roll it up, and the fluids are now gonna run through that line. Make sure all those blue clips are like just vacated, and then there you go. Easy. So hold the needle just like this, bevel up, and then you're gonna draw a tent. It's just like it sounds. That's the tent, and the needle goes where the people would go into the tent. Now, the good news is that your cat has way more room than you do in the subcutaneous space. So let's tent your cat. Grab over the skin, over the shoulder blades. You're just pulling up that skin, just like you did on yourself, and make the tent. Needle goes in, and give it a good poke. You know, you just don't want to scratch him. You want to just poke that needle in, and it's not too bad, is it? It's not like stabbing him. Look at Zach. He's not worried about it. They can flinch and do stuff like that, but that's pretty normal. Now, you can do this single-handedly, and it can work. You're just going to take that bag, you can hang it up. I usually just, throw it against the wall, throw it against the fridge. I'm not that delicate with it. Now, look in that chamber. Do you see that flow? That's a good flow. Good, solid flow. It tells me the needle's in the right place in his body. I can even put it underneath my knee. And if you've gotten this far, congratulations. You've given him something that's absolutely going to help your cat. Okay, if you're anything like us, we are like hustling. We're busy all the time. We've got kids. We can't keep up with anything. Our place is a total mess. We can't have anyone over. It's embarrassing. But whatever. You gotta get the fluids in. So this is the super fast SHEBANG technique. You get your bag, get an IV extension and two 60cc syringes. Pop those babies out. Get 2 of them, okay? So you attach your 18 gauge needle to that, just like so. Remember, keep it clean. Don't touch parts that need to stay sterile. And just get those fluids out there. And just really pull on that. I know, don't hurt your thumb. You're gonna get that air out of that syringe. And watch, you're gonna get this IV extension line. They're really easy to find. And you're gonna hook that up between your needle and the syringe. And then sit back and watch how fast you can give fluids to your cat. Look how fast that is. And look at Zach, he's not worried about it. And SHEBANG! Look at that. Okay, if the fluids aren't going in as smooth as you think they should, redirect the needle. You're going to gently move it left and right, in and out a bit, until that flow starts to run faster. Sometimes I even massage as I'm getting those fluids running in. I'm just doing a gentle massage and redirecting all at the same time. I kind of like it. The first time that needle hits the floor, fluids all over the place, you're going to feel like a disaster. But don't worry, give him a break, change the needle, and you're good to go again. Now remember, these are subcutaneous fluids, not IV. So air, you got to be careful, but it's not critical. That's too much air. You want to get that air out of the line, but this much is okay. And little bubbles I'm not worried about. So sometimes you're going to notice some, they're going to be wet, you're going to notice some blood-tinged fluid, and you know what they look like after that happens? They look like this. Don't worry about it. It's a big needle, isn't it? As long as you're doing that tent technique, you're not going to hit anything with the needle. You're not going to hurt them physically. Don't worry about it. These bags suck. As far as measuring a specific amount, they're not designed to do that. It's a rough guideline. IV pumps are designed to do that. Calibrated drip rates are designed to do it. These bags pull the top and the line moves. You hold them a certain way on the bottom, the line moves. You're guesstimating. So that syringe SHEBANG technique is actually the most accurate as far as measuring specific amounts. But as long as you're consistent, you'll get an average amount in. not giving too much, you're not giving too little. You're giving just the right amount because you've got your cat's body weight and you got a calculator. I never give fluids without doing a calculation. After I've done a physical exam on a cat and, I know their weight and I know everything I need to know about them, sub-Q fluids is a very safe thing. I've never run into a problem in 10 years and thousands of doses. So even though I suck at math, I'm pretty good at doing these sort of calculations, so this is how it's done. Like all things in vet medicine, theoretically or on paper, it's one way, but in practice, it's another, especially with cats. So if your cat's dehydrated, how do you tell? Well, the typical things is to look for tacky gums. That's you put your fingers on their gums, and if it's tacky and not moist, sign of dehydration. You can do a skin tent, which is to pull the skin, let go, and if it snaps back, they're good. If it doesn't snap back, they're dehydrated. For cats, it's difficult, and usually those two aren't that accurate for me. I'm usually assessing a multitude of things to figure out their hydration status. If they're truly 5% dehydrated, this is your calculation. So how often should they be getting these fluids? Well, it's both an art and a science. For Zach, for example, with his multitude of issues, it goes anywhere from once a week to twice a week. If he's got a flare-up of something, then it could go more often. You should have a good relationship with your vet who's well-versed in your cat's issues to figure that out. What if your cat hates this, hates getting fluids? You can warm up the fluids. Zach actually doesn't care if the fluids are warm or cool. No effect for him, but your cat might. Your cat might really care, so try warming them up. You can put them in some water. You can use the microwave. Believe it or not, they've done studies to show that it's safe to use a microwave, but it's just like a baby's bottle, not too hot. You can use the smaller gauge or bigger gauge needle. Again, Zach doesn't really care, but your cat might. Sometimes I use these little butterflies, put them on. The smaller the gauge of the needle, the longer it's going to take to get those fluids in. And sometimes it's the time that matters. They don't want to hang around there for too long. Put them in a box. Make it nice. Put a little towel. You can spray it with something called Feel Away so they feel good. They tend to feel pretty good in those confined spaces. Use that to your advantage. Set some atmosphere. Put on some music. Get some tuna or catnip, whatever your cat likes, and pat them on the head or those little head taps or body taps they tend to love. And Zach loves his fluids now. He comes running for them because he gets treats. Okay, final tip. I can tell you this, with anything medical, especially anything to do with cats, you're not going to hit the ball of the park every day. Some sessions are going to be more successful than others. You're learning, and they're learning. It's okay. Even if you only get 20 or 30 mils in, that's 20 or 30 more mils than some people would ever do. As a vet, one thing I can say with certainty is that playing catch-up is never as good as being ahead of the curve. You can catch the right things before they become problems that steal years of their life away. I do this every day for my patients. That's my goal. Then 14 can become 19 and beyond. Even if they are sick, you can turn it around and have them live to their potential. It is amazing that cats can be in our life for decades.